My name is Natalie Fee. I am with Pinellas County HR, and I also have Danielle from Aetna. So Danielle's going to start with doing an overview of the Aetna plans, and then I will go over the rest of your benefits for annual enrollment. So Danielle, go ahead.
Thanks, Natalie. You can go ahead and flip to the other slide just to get us started here, or even if you want to go in 2 slides, it's perfectly fine. So welcome everyone. Thank you for taking some time out of your afternoon to join Natalie and I. I'm going to be spending roughly about the next 8 to 10-ish minutes just going over your benefits for 2026. For a lot of you, it may already be familiar. No changes, so nothing concerning there. But we're going to go over the following topics that you're able to see on the screen, such as how we keep it simple to see your doctors, a highlight of your coverage and costs with the Medicare Advantage plan, some of the extras that you're going to get with the Medicare Advantage. And then at the very end, if Natalie, you're okay with it, I'm able to open it up for Q&A. Perfect. Okay, go ahead and perfect. So we do know that one of the most important things for our members is, are you able to keep seeing your doctor if you enroll into this plan? So on the next slide, I'm going to review how the plan makes it really simple to see the doctors that you all know and that you trust. So with over 1.3 million network providers and over 4,300 network nationwide hospitals, you are absolutely able to see the doctors that you know and you trust. Plus, we do not require a referral for you to see a specialist. So under our plan, it's referred to as the Aetna Medicare Advantage PPO ESA plan. So that ESA, known as Extended Service Area, allows you to see doctors that are out of our network for no additional cost, as long as they are eligible to receive payment from Medicare. So as long as they contract with Medicare and they're also willing to bill and accept payment from Aetna. And then you're also, if you are covered when you travel nationwide. If you do happen to travel out of the country, you are covered in case you have an urgent need for medical care. Now, you may be required to pay the bill at the time of the service while you're there. You would just want to make sure that you keep your paid receipts and all of your documentation to submit to Aetna for reimbursement when you return back home. And then you can go ahead and flip for me. So let's go ahead on the next slide. We'll take a quick look at some of the highlights of your medical benefits. The plan does include comprehensive coverage, including 100% coverage for most preventative services, predictable copays for most medical care, benefits that complement your doctor's care, and help you manage your total health. We also have lower cost and more benefits as well. So on this slide here, you're able to see that you have no changes changing for 2026. So you're going to continue to see a $0 deductible. Your out-of-pocket maximum will remain at $1,750. All preventative care remains covered at 100%. Primary care visits will remain at $10. Your specialty care will remain at $15. An inpatient hospital stay is going to remain at $50 per stay. Outpatient surgery is $25. Now, emergency room is a $50 copay, but if you're admitted, that copay is waived. Your ambulance services are $50, and then physical therapy will remain at 0. And you can go ahead and flip. Perfect. So we're also going to go ahead and dive into your Part D, known as your prescription drug coverage as well. So with over more than 65,000 pharmacies and over 23,000 preferred pharmacies nationwide, filling your prescriptions is very easy. Now, you'll typically pay less when you get your prescription drugs at a preferred pharmacy, and finding a network pharmacy near you is very simple. You can visit AetnaRetireePlans.com in the Find Doctors and Prescription Drug section to view our online directory, or you can even call the number on the back of your ID card, and we can assist you with this as well. With the CVS Caremark Mail Service Pharmacy, you do have the option of having your prescriptions delivered right to your door within 10 days. Your plan does offer a long-term supply at select retail pharmacies and mail order. So to get started with mail order, if it's something you're interested in, it's 2 easy steps. For step 1, you would see if your medication is available through mail order, and then you would want to check your plan formulary just to make sure that the drug is covered. And step 2, you would just choose how you sign up. You can register online through our member website, or you can even call member services on your ID card. You would just let us know how you want to pay for the order. That way we can avoid any processing delays. We accept a major credit card, debit card, and electronic check. And if you'd like to learn more, please feel free to call us at any time. So let's go ahead and take a look at your prescription drug benefits. Again, we have no changes for your prescription as well. So we have the pharmacy network known as P1. This just means that you have the option to go to our preferred pharmacy and our standard. Your formulary is known as Comprehensive Plus, and this is just for reference. If you go online and want to pull a list of your drugs that are covered, you would just want to make sure you click 4-tier Comprehensive Plus, so that way it tells you what tier your drug falls onto. Your deductible is going to remain at 0. Now, tier 1, you're going to see the 2 cost shares. If you go to preferred pharmacy, you'll pay a $5 copay, but any of our standard pharmacies is a $10 copay. Your tier 2 is 20, tier 3 is 35, and tier 4 is 35. Now for catastrophic phase, this is the one tiny change you're going to see for 2026, and it's only that the out-of-pocket maximum is increasing from $2,000 to $2,100. And then if you happen to reach $2,100 at some point in 2026, for the remainder of the year, all of your Medicare Part D drugs will be covered 100% until 2027. And then you do have your mail order drugs as well. And it's a 3 times retail cost share for a 90-day supply for tiers 1 through 3. And then for tier 4, it's a 2 times retail cost share. Okay, perfect. And this slide here, the next 2 slides, are going to go over some of the extras that are included with our plan. So starting with the healthy home visit, this allows you to have a home visit from a licensed medical provider or nurse to assess your health and safety needs. They can identify potential safety hazards, discuss concerns you may have, review any medication, medical and family history, and offer care advocacy resources and support programs. You do have a hearing aid reimbursement as well, where you can get the cost of your hearing aids reimbursed from any licensed provider that accepts Medicare. And you do get $500 reimbursed every 36 months on your hearing aids. We have our 24-hour nurse line that lets you have a toll-free 24-hour access to nurses who can help answer your health questions. You can speak with a registered nurse day or night to get help with concerns such as deciding whether to visit a doctor or urgent care, understanding your symptoms, managing chronic conditions as well. We have our Silver Sneakers Fitness program that gives you a basic fitness membership at access to thousands of participating facilities nationwide, and this is at no additional cost to you. You can also take online classes at home or get a home fitness kit. And then if you have an iPhone, you can use Apple Fitness Plus to enjoy access to workouts from anywhere at any time at no additional cost to you. And then we do have non-emergency transportation that does give you access to 24 one-way rides for non-emergency transportation. And this could be to and from your medical appointments, or even if you need a ride to your pharmacy to pick up your prescription. And then we have our over-the-counter benefit. And this allows you to get over-the-counter products online, by phone, or in participating CVS pharmacy stores. And then lastly, we do have our Teladoc Health, and this is where you can connect with our primary care providers 24/7 by web, phone, or mobile app from home for non-emergency medical needs. Now, this could be along the lines if you say you have the flu, you have even basic questions, you may need a prescription refilled. You're able to call in and speak with these providers, and they can help assist you with that. Perfect. And then we have our support resources as well. And at first up here, we have resources for living. And this is where a life consultant can connect you with a wide range of cost effective and reliable services in your area. This could include help at home, transportation, social and recreational activities, caregiver support, and more. Now, you would only pay the cost for any service that you decide to actually use if there is a fee associated. We do have our post discharge meal benefit that gets you meals at home to help support your recovery. Eligible members may get 14 freshly prepared home delivered meals after a qualifying inpatient stay. We have our Aetna Compassionate Care program that helps with treatment decisions and support to members, families, and caregivers for advanced illnesses. And our care managers can facilitate advanced care planning, promote coordination of care with providers, connect you to resources in your community, and provide emotional support to you and your family. And then lastly here, we have our HealthWise knowledge base, which allows you to discover online tools and resources to help you live healthier and manage your conditions. And that does bring me to the end of my short presentation. So if any of you have any questions, please feel free to ask them. I will be on now or even after Natalie finishes as well.
So if you guys have any questions, there is the Q&A feature, so you can go ahead and put them there. Oh, Linda, I saw you had your hand up, and I didn't know if you still had a question. I can unmute you if that's easier. Okay.
Hello.
Yes, go ahead, Linda.
Thank you. Yeah, so I have a couple of specific questions related to the extended service area. So I understand that we can get coverage as needed when we're traveling, but let's say I live 6 months of the year here and 6 months of the year somewhere else. Do I have full coverage in the place that's not here?
You do. So the plan follows you all across the United States. So whether you're in California, Florida, Arizona, Kansas, wherever you're at, your plan will cover you the same. So if they're part of the Aetna network, that's fantastic. We don't have to worry about if they're going to offer coverage. But if, say, they don't accept Aetna, as long as they're willing to send us the bill and they contract with Original Medicare, your coverage will be exactly the same as if you're at home.
Okay, and the fine print, and I noticed you said all across the US. So what if I decide to spend 6 months of the year in another country? Am I covered there?
So in another country, it's only for emergency medical needs. So if you had to go into the ER for an emergency, and that is a reimbursement. So if you happen to meet another country, we absolutely only recommend if you're able to only go in an emergency place. That way, if you happen to go to PCP, you're not going to see any kind of coverage.
Okay. And then my other question is, what if I decide to permanently relocate outside of this area or the state of Florida? Do I
That's
have to drop
Mhm.
coverage or am I covered?
So on Aetna's end, you are totally fine to live in whatever state within the US as long as Pinellas County is okay with it. Aetna's perfectly fine. You do not need to be based in Florida. You can move wherever and your coverage will be just the same as it is now.
Okay, so you said that Aetna's okay with it, but why would Pinellas County have a say in where I get to live?
Oh, not they should not at all. What we say sometimes is sometimes what we see with other accounts, they may only offer the plan where they're located. It's not very common. So, like, let's say you move to California and Pinellas County is willing to still offer you the plan with you living there, then we're perfectly fine as well.
Yes, and Linda, there's no issue with you living in another state. We have many retirees who live in other states on the Aetna plan.
Okay. All righty. And I just thought of something else. How long is Aetna's current contract?
Right now it is through the end of next year, and then we'll do a renewal or RFP at that point.
Okay, so if there's there is always the potential once it goes out to bid that another provider could be awarded the contract that's not Aetna,
Yes, it's a
or that would
possibility.
be, or that the new contract might not allow for living someplace else. Is that
I
correct?
don't think Pinellas County would ever change their stance on that. At least that hasn't been in discussion, as
Okay.
far as I'm aware. Yeah, so I don't think you need to worry about that.
Okay. All righty. Thank you so much.
You're welcome. If you have any more questions, just raise your hand again. All right, we have some questions in the Q&A, and somebody would like to know more about the over-the-counter benefit with CVS. Can you talk more on that, please, Danielle?
Yeah, absolutely. So basically, we do have an online catalog, or you can go into a participating CVS, which since we're contracted with CVS and, uh, they have bought out Aetna years ago, we partner with them directly for the over-the-counter benefit. If you give me just a moment here, I can actually pull up how much the allowance is. It's usually on like a quarterly basis. So give me just a moment and it should pop up for me.
I believe it's $30 per quarter, but you can confirm that.
Yeah, I believe you are correct. I just want to double check. Yes, so you do get an allowance of $30 every quarter. So you are able to shop at any of our freestanding CVS pharmacies, or you can call Aetna directly. We can help assist you with it. Or you can even view the products online. If that's a link we need to get, I'm happy to send it out to the Pinellas County team to distribute to you all.
Thank you. Okay, and then somebody is questioning the hearing aid reimbursement of $500. They're saying it's only $500. So can you just reconfirm what that benefit is and the period?
Of course. Yes. So it is a $500 reimbursement every 36 months at this time. Now, it's always something that Aetna and Pinellas County can look at to possibly increase in the future, but at least for 2025 and 2026, it is a $500 reimbursement every 36 months.
Okay, and then someone wants to confirm that we do not have to use Walgreens now. So the preferred pharmacy would be CVS, right, Danielle?
We have quite a few preferred pharmacies, and that's also something we have a listing of that I'm happy to send to you, Natalie. If you want to distribute out to your members, that can certainly be shared. But no, CVS is on there. I know, like we have Publix, we have Wegmans, Walgreens is still on there. We have quite a few preferred. But if you have a pharmacy you really, really love that is not preferred and they're just standard, you are more than welcome to continue using them.
Okay, so they won't pay more for going to a non-CVS pharmacy?
So on our preferred pharmacy listings, there's I think 20 or 30 different pharmacies we have on there. If any of those, CVS is one of them, but we do have more. Like I know Wegmans and Publix are on there as just off the top of my head, I know as preferred. So out of any of the preferred listing ones, they would not pay more. So they're not
Oh,
required
okay.
just to go to CVS for a preferred price.
Okay, thank you. All right, and then someone asked, please explain the annual maximum. Our drugs maximum is not the same as medical. So do the drugs have a separate max?
Yes, so that is correct. Your medical out-of-pocket maximum is separate from a prescription out-of-pocket maximum. They've never been combined in the past. And even though you have one ID card combining the plans, in a sense, you got to almost separate them out in your mind. Like medical is its own thing for medical strictly. And then you have your prescription drug plan, which is strictly referred to as a Part D plan. So for any prescriptions that are covered under your Part D as in drug, you will pay up to, for 2026, $2,100. Once you reach that 2,100, if you happen to, then the rest of the year, your prescriptions are free until you reach 2027. And then for your medical side, let me go back and check really quick. It is a $1,750 out-of-pocket maximum. So any copays that you're paying throughout the year, every time you go to your doctor, if you have an inpatient stay, say a surgery, all of that accumulates until you happen to reach the 1750. Same thing here. If you do happen to reach the 1,750 out of your own pocket, the rest of the year, Aetna kicks in 100% and you would not pay anything until 2027.
Okay. And then is there a program that's like an FSA plan included? So we do not offer an FSA for retirees. And then this one we may need to circle back on, but someone's asking what tier is Enbrel medication? Are you able to access the formulary or do you
I
have
can.
Okay.
Yeah.
Do you want me to ask the rest of the question or do you want to look that up now?
I am actually pulling it up right
Okay,
now.
perfect.
Could you just verify for me really quick how it's spelled?
Yeah, Enbrel.
So on the formulary that I am pulling up for 2026, I am actually at this time not showing that it is a covered medication. Now, in this case, we can always take it offline, just to double check that we're, if spelling or anything is incorrect, or sometimes what they'll do is put a preferred or a generic on the formulary instead of a brand name. But I'll take that one away, Natalie, and follow back up with you just to make sure we're looking it up correctly. But in the event that it's truly not a covered medication on the formulary, if it's something you absolutely have to take, and this goes for any medication, your doctor can always submit a prior authorization to have an exception put in. So, as long as your doctor is submitting medical documentation showing why you need it, our physicians on our end and our nurses will all take a look at that, and we can always see an approval just to make sure it is something that truly needs to be taken, and we could possibly get an exception made for you. But I'll definitely circle back on that and get back with you, Natalie.
Thank you. And whomever asked that question, it was an anonymous question. So if you just want to email or call employee benefits so we can follow back up with you on that, we'll be happy to do so. All right, the next person has multiple questions. So the first one, why was the premium increase so high? So if you were employee only, or I mean retiree only on the Aetna plan and you were hired before 2011, the increase wasn't too bad. It went from like 156 to 168 per month. For the rest of the tiers, I don't know off the top of my head what it was, but in general, I don't think it was too high of an increase. I think it was around 7%. But unfortunately, just the premiums tend to increase every year due to the health of everybody on the plan. So that is why the premiums increased. And who are the 2026 preferred pharmacies? I think we talked a little bit about that. And Danielle, I think you said you could send over something to me about the preferred pharmacies.
Absolutely. I'll send you a PDF version and that can be distributed to whoever you'd
Okay,
like.
awesome, thank you. And then the copay for urgent care is significantly higher than walk-in clinic, but none of the walk-in clinics listed in my area are open. Okay, so that sounds like a network location issue. If you wanted to reach out to Aetna directly, they can, I'm sure, help you find somewhere to go for your health care that would not be as expensive as urgent care. And then why is hearing aid coverage so low? So we kind of touched on that earlier. But we can definitely take that back to the team on perhaps increasing that benefit for future years. Okay, once the retired employee dies, what options are available to the living spouse? So if your spouse is on your medical when you pass away, then we would offer them surviving spouse benefits and they would just pay the retiree only rate. So they would just need to reach out to us at that time and we'll help them out. I don't understand the 4 different tiers. Can you explain? I will be a member in January. Does the copay include the cost of medicine? Can you answer that, Danielle?
I sure can. So, when it comes to a formulary, drugs are covered under what we call tiers. And so, to make it easy, simply tier one is your generic drugs. Tier two is something usually known as preferred brand names. Tier three is known as your non preferred brand name drugs. And then tier four is typically known as specialty drugs. So each drug, whether it's generic or a brand name, falls under one of those tiers, which, depending what tier it falls into, lets you know what your cost would be. So, just to keep it simple, let's just say you're taking a generic medication. That's going to fall under tier one because tier one is known as generic. And so, what that means, if you say you go to a preferred pharmacy, you are only going to pay $5. Even if, say, the drug is just, let's just assume it's outrageous and it's $500. You yourself are only going to pay the $5. If you use a standard pharmacy, the most you're going to pay is $10. So whatever your copay says next to your tier, that is the only cost you're going to pay as long as it's on our formulary. And like I said, if there's a drug that is not on the formulary, if your doctor submits a prior authorization and we do approve an exception, we then would assign a tier to the drug to let you know how much your cost would be.
And then will we be getting a new printed booklet like we did last year, or do we always have to go online and find the information?
So every year they will mail, Aetna does mail out your annual notice of change, and then you will also get what we call a schedule of cost share in the mail. Now, if you're looking for something like the formulary, or even if you're referring to, say, something like a whole outline of your benefit summary, that's always something we can mail to you. Or if you want a PDF copy, we can always distribute it to Pinellas County, which they can in turn share with you. But if you're looking for something in particular, please feel free to reach out to Aetna or even to the county, and then they in turn can get with us if need be.
All right, great questions. I think that's it for now. But if you guys have any more questions, please feel free to put them in the Q&A and we will answer them. So I'm going to go ahead and continue on with the presentation with the Pinellas County portion. So annual enrollment, as you all know, is going on currently. It started November 1st and will go through the end of November. So that's when you have the opportunity to make any changes. So November 30th is your deadline. And then it is a passive enrollment. So if you do not need to make any changes to your benefits, you're keeping everything the same for next year, then you do not need to do anything. If you are making changes, you should have received an enrollment form in the mail. And so just make sure that you submit that back to us by November 30th. And then any changes that you make are going to be for benefits effective January 1st. So we have an annual enrollment website, which is live now. That's where we will be posting today's recorded information session. If you want to refer back to it, or if you have any friends who are also retirees who are unable to attend today, you can share with them that this is going to be online. And then a summary of all of the changes for annual enrollment are going to be online as well. And then you should have received some mail from us maybe a week or two ago. It has a personalized letter, so it outlines what you currently are enrolled for, just in case you forgot or you want that for your records. And then the benefits team is always available to you guys if you need to make an appointment to come in and speak with us, or you can always call us. We are here from 8 to 5, Monday through Friday. So we talked about the medical plan. So going into the dental, we continue to offer the same 3 dental plans with Cigna. Absolutely nothing is changing with the Cigna for next year. The only thing that is that we increased the benefits a little bit under the PPO plans. So with the Cigna Dental PPO Basic Plan, this covers 2 cleanings and 2 exams per year at no cost to you. Just remember that if you're doing those deep cleanings, those are not considered preventative and those would fall under basic restorative care. And basic restorative care is covered at 80%. Major restorative care is covered at 50%. The annual max that the plan will pay out per covered member is $2,000. So the coverage that we expanded for next year going forward is that we've now expanded coverage for sealants for children up to the age of 19 instead of the age of 12. And then we also expanded coverage for porcelain crowns for your second and third molars. The second dental plan that we offer is completely identical to that PPO basic plan, except for that this has the orthodontia benefit. So orthodontia would be like braces or Invisalign. So if you or your dependents don't need braces or Invisalign, you do not need this plan. This plan pays out a separate lifetime orthodontia maximum of $1,500. And then the third plan that we offer under dental is the HMO plan. It is a very low cost plan. If you want it, just know that it is a very bare bones plan. You have to stay in network and the cost of procedures would be based on a fee schedule. And if you are not living in Florida, then this probably is not the best plan for you since it doesn't have much coverage outside of Florida. And then these are the dental premiums. This is what you're paying now, and this is what you're going to be paying next year as well. And these are the monthly rates. And then under our current plan arrangement, as long as you are enrolled in the county's medical plan, you are automatically enrolled in the iMed Vision plan. So we did increase the vision benefits for next year. So we increased the frame allowance from $130 to $150. We increased the contact lens allowance from $100 to $150. And then we implemented a program called I360, which has a preferred network of plus providers. So if you go to a plus provider, you have access to additional discounts. So I'll show you on the next page some examples. So for example, if you are getting an eye exam, if you go to an in-network provider, you're going to pay a $10 copay. However, if you go to a plus provider, you aren't going to pay any copay. And then for lenses, you get your $50 allowance. And then if you go to a plus provider, you get not just your $150 allowance, but you'll get an additional $50. So with the plus provider, you can get up to a $200 discount, and then your normal 20% discount on any balance over that $150 or $200 allowance. And then you can also get a second pair of glasses as well. So how do you know who's a plus provider? Most of them would be like Target Optical, LensCrafters, Pearl Vision. If you go onto your iMed account online and you look at the provider directory, the plus providers will be designated with a pink plus sign. So that's how you're going to know who's a plus provider and who is not. And there's a question, ophthalmologist bill under medical, correct? I want to say you are correct. Any medical procedure regarding your eyes does fall under the medical plan, not the vision plan. And retinologist bill. So yeah, let me just double check that. Danielle, do you happen to know by any chance on ophthalmologists and retinologists? Do those fall under medical?
So typically we would say what would fall under a traditional or, annual eye exam is what's going to be billed under the medical. Now I can always take that back as well and see if I can get exactly for sure what they're able to bill to us and what would fall under vision, but typically if you're going in for your annual visit, that's typically billed to us.
Okay. All right. Thank you. Yeah, Mary, we'll just double check that for you and get back with you. All right. So that's the IMED Vision. So if you want additional discounts, make sure you go to a Plus provider. And then when you make your elections during annual enrollment, or if you're keeping everything status quo, just remember that you are locked into those benefits for the full year and you cannot make any changes unless you have a qualifying life event. So that means marriage, birth, divorce, or your spouse loses coverage elsewhere. And then just make sure that you let us know of any changes that you need to make to your benefits within 31 days of that life event. That is an IRS regulation, so we have to stick to that 31 days. So if you need to make a change to your benefits, just call us within that 31-day window and we will walk you through that process. And then the other thing that you guys have as a benefit as a retiree is the life insurance. So you cannot ever increase the amount of life insurance that you are currently enrolled for, but you can decrease it at any time. And if you don't have life insurance now, you cannot enroll for it. And then just remember that there is that age reduction with the life insurance. So once you turn the age of 65, the value of your policy reduces to 65% of its original value. And then every 5 years after that, it will continue to reduce. So once you reach the age of 80, you will be left with 20% of your original value. Now is a good time to review your beneficiaries. If you need to update your beneficiaries, you can fill out that enrollment form that we sent you. There's a section to update your beneficiaries, or if it's sometime throughout the year, just call us and we will send you the beneficiary form. Another benefit that is available to you or a resource is FedLogic. So we partner with them to provide federal and state benefits information and advocacy for you guys. They are an independent resource to help you navigate and maximize benefits such as Social Security and Medicare. Their experts can help you tap into all the benefits available, because here in the Pinellas County HR office, we are not the experts in those types of benefits, Social Security, Medicare. So FedLogic is a really good resource if you need to find out any more information about those programs. The service is confidential and unlimited and free to you guys and your household members. They're not going to try to sell or promote any products or services. If you need their contact information, that is out on our website. If you go to Pinellas County, or if you go to pinellas.gov/HR, we have an A to Z index like the alphabet. So if you hit the letter F for FedLogic, it'll take you to their webpage and phone number. And then, as you guys know, this year we implemented the dependent verification process. So if you are adding any new dependents for next year, you do need to verify them. So if you are adding a spouse, we would need a copy of your marriage certificate and 2 joint financial statements, or a copy of last year's federal tax return, just the first page. And then if you're adding any children, we would need a copy of the birth certificate. So you can either email that to employee benefits or come by the office and drop off a copy. So you don't need to do it if you already did it earlier this year. It's just for any new dependents that you might be adding for next year. So here's our resources. There's the annual enrollment website and our contact information for the employee benefits team. And just make sure to watch your mail for any important information from now through the beginning of next year. All right, looks like there's a question. It looks like this year we do not need to provide proof of dependence on the plan. Is that correct? Yeah, so I just talked on that. You just need to provide dependent verification documents for any new dependents for next year. You don't need to resubmit if you already did it for your current dependents. Are there any other questions? All All right. Well, if there are none, you guys are free to leave. Thank you for joining us this afternoon. Otherwise, I will stick around for a couple more minutes in case anybody else has questions. Thank you. You guys are welcome. Thank you. Thank you, Danielle, for joining today.
Oh, my pleasure, Natalie. I will send you the PDFs. I will also send you the link for the over-the-counter benefit, and then I'll take embryo back and I'll check with our
Okay.
clinical team as well.
Awesome. Thank you.
Of course.
All right. I'm not seeing any more questions, so I'm going to go ahead and end today's session. If you have any questions, please reach out to us. Thank you.